watching Conversations with Jennylyn, formerly known as the Jennylyn Show. And tonight, I have a very fascinating guest to share with you, Dr. Anthony Chang. And he has so many distinctions behind his name that I'm not going to attempt to say them all, but I will have him tell us about all that he's working on, and it's a lot of fascinating stuff. So just keep watching. Dr. Chang.
Nice to meet you.
Thank you so much for coming on my show.
Thank you. Thank you for having me today.
Of course. How could I not?
Yeah.
So you are spearheading artificial intelligence internationally.
Yes.
So that means you have a lot of stuff to tell us.
Yes. Well, it's been a very, very busy year this year. We went to London in September, and we just wrapped in China a few weeks ago, and we're about to have our flagship meeting on artificial intelligence in medicine in December in California. So it's more than a series of meetings, and we visited many cities, about 24 cities, and have breakfast meetings, but it's mainly about creating awareness and education for particularly doctors to understand that the new paradigm is about to happen. And it's going to be the most exciting 25 years in medicine coming up.
Wow, well, that leads me to my next question. Do you want to explain exponential medicine for us?
Well, exponential medicine is, if you're referring to the meeting I spoke at a couple of weeks ago, my friend Daniel Kraft started that meeting, and it talks about all the technologies that are available now that are sort of improving exponentially. So medicine's going to go along for the ride in terms of just having lots of discoveries and making everyone's lives healthier and better.
So it's a meeting with all the experts, and right. you're pooling your innovation and...
Right, exponential medicine is more about innovations and about advanced technologies like genomic medicine, like 3D printing, like wearable technology, whereas artificial intelligence in medicine focuses on sort of a topic under that. So we focus on use of data science and artificial intelligence in medicine, but the two are certainly interrelated.
So there are a lot of terms flying around now. Yeah. So I'm just going to bring them up and have you explain it in layman's terms.
Sure.
I've read up a lot on it,
okay.
but we want to hear from you.
Okay.
So tell us about big data in medicine.
Okay.
How is that related?
Big data in medicine is very simple. It just implies that the data is so big now in terms of the quantity and the volume of data that a normal computer with an Excel spreadsheet can no longer handle. So big data, which is what medicine has now, means that the amount of data generated from all of our electronic records and all the medical imaging, the volume has gotten so big that a one standalone computer can no longer handle that amount of data.
Okay, well, thank you. And artificial intelligence in medicine. I mean, this is vast.
Yes.
So tell us, how can you simplify it so the average person wondering what it is will understand?
Sure. Artificial intelligence, I think, the best definition I've heard is still the first one by my hero, Marvin Minsky, who is a computer scientist. And he said artificial intelligence is basically intelligence from a machine that doing something that would take intelligence from a human being. So essentially a machine doing something that would take intelligence by a human being. So that obviously has a pretty wide range. So we can talk about the several different types of artificial intelligence. It goes from the vacuum cleaner that goes around your room now automatically. So that would be something we call assisted artificial intelligence. Right. It's just kind of programmed to do something, doesn't really do anything beyond that. And then the most exciting development in artificial intelligence is what we call augmented intelligence, which means the humans and the machines are actually cooperating and collaborating and working together to improve the task.
Right.
So all you're hearing about machine and deep learning are essentially in the augmented sort of category. The most exciting thing in the next decade or two are going to be something called automated intelligence, which means I know some people are intimidated by this, but that means the machines are going to have a method or a way to learn on their own and get smarter.
Wow.
Without necessarily human intervention. So that's the part that intimidates a lot of people. And as you know, you have famous people like Elon Musk and Stephen Hawking claim that this is going to spell doom. And I think, and then whereas other people are a lot more optimistic. And I think the truth is somewhere in the middle. I think there's going to be tremendous gains in all sectors of our lives, but I think particularly healthcare. And I think that's has to be tempered with, what we allow the machines to do. So we need to be careful with that resource. It's as a Stanford professor, Andrew Ng, says correctly, that it's the new electricity. And you can do lots of great things with electricity, but you also have to be careful with that new resource. In healthcare, I think we don't have data and a lot of things organized yet compared to other sectors.
Right.
So I always say electricity might be the new, AI might be the new electricity, but in healthcare, it's like having a single light bulb in a primitive HUD because we're just not set up to use the resource. But hopefully we'll catch up and make great use of that resource.
Wow. So since you're the founder of AI internationally, how do you feel about the Chinese claiming that they're going to be taken over from Silicon Valley in terms of AI because they're more advanced? How do you address that?
Well, I am hoping that this won't turn into an arms race because I think if we collaborate more, I think we can gain so much more.
Great attitude,
I think, yes, the Chinese are definitely putting a lot of investments and human resources into AI. Probably in the next 5 years, they will surpass even MIT in terms of significant publications in the areas of research for AI. And they certainly have more than half the dollars are invested in AI now. But I'm hoping that, particularly in healthcare, that we collaborate between the US and China, as well as other countries that are known to be very strong in AI, like Canada, like the United Kingdom, Israel. All of these countries really have a lot to contribute. So I'm hoping, despite the rhetoric about the sort of AI superpowers competing, I'm hoping that the healthcare arena will be the sanctuary for all of us. And I think it will. But it really means that the clinicians and nurses and everyone in healthcare and also patients will really have to put emphasis on collaboration rather than competition.
Right. But since you're the founder, what is your feel currently from your interactions with them? Do you get the feeling that they'll be willing to collaborate?
Well,
because they can be very competitive.
Yeah. Well, I founded the series of meetings called AI in Medicine, or AI Med, and I'm hoping that the series of meetings will lead to a movement of clinicians all around the world collaborating using AI as a resource, because clinicians are not usually educated or indoctrinated in artificial intelligence or data science. Maybe a tiny percent are. I think if we all work together and collaborate, I think that will inspire the next generation of clinicians to be a good number of them. I'm hoping 1 in 10 or more will become a clinician with a data science or artificial intelligence background. And I think in the future it will happen because it's sort of a necessary skill set that a clinician of the future will have to have. So I think as long as clinicians are willing to embrace this and not be afraid of this resource and continue to utilize it as a resource, I think it's going to be the most exciting 25 years in medicine that probably we've ever seen, without exaggeration or melodrama.
Well, egos always get in the way.
Yes.
And that's where the competition comes in. So you can only hope, because you can't really speak for how other people are going to behave. So I'm hoping it turns out that they're willing to collaborate, because it would be great for the world.
Well, I think I'm worried less about
the competition.
Egos or hubris amongst clinicians, because clinicians, particularly clinicians I've come across in this domain, are very willing to share ideas and collaborate. We have to be careful with hubris on both sides in terms of clinicians and data scientists or AI gurus. There's a lot of talk about AI versus doctors, and I'm always saying let's forget about that juvenile rhetoric and talk about AI plus doctors will be probably the best doctors if we just combine the human expertise, what I call clinical intelligence, with artificial intelligence or machine intelligence to have a new brand of medicine that I call medical intelligence, which sort of blurs the boundary between humans and machines, which is what I like to do. But despite that, in Silicon Valley, there's some vocal people that wants this AI versus doctors sort of mindset, and I think it's going to go away, and I'm hoping that'll go away because it's not really about the competition. And if it's a competition, it's going to make, I think, clinicians feel not just only threatened, but not in favor of this new technology.
Got it. So, how do you feel about the doctor who has altered the genes of an embryo in two women? What are your feelings on that?
Okay, so now we're into another advanced technology of genomic medicine.
Is that a part of AI? Because I wasn't sure.
Yeah, you probably need some AI or data science to do genomic medicine, but there's some overlap. But I think in the area of genomic medicine, which I'm not an expert on, but I read about it because of my interest in innovation and advanced technologies, I think, like AI, we have to be very careful with that new technology.
Right.
If I was just reading an editorial in the New York Times today on the way up here, and it was saying basically for technologies, and I think it's true for all the advanced technologies, but particularly in medicine, that we need to slow down and adopt later. And that was the headline of the editorial.
I think I read this in an article.
And I think that's certainly true for AI and certainly true for genomic medicine and certainly true for other advanced technologies in medicine, that we need to be particularly careful because we don't want to surge ahead and too far ahead of ethics, too far ahead of cultural biases, too far ahead of controversies and lack of sort of business structure for all of these advanced technologies. And we tend to be very distracted by the shimmering new technology and sometimes forget that we have to do our homework and we have to do our preparation for that technology to really take hold for the long term. And I think, just coming back to artificial intelligence in medicine a little bit, I think Bill Gates was the first to say very correctly that we tend to overestimate the early delivery of a technology, and then we underestimate the impact long term.
Right.
And I think that's happening in artificial intelligence in medicine, where there's almost a hype about artificial intelligence in medicine, especially when we deal with medical imaging and some decision support, that artificial intelligence is really making impressive gains. But I think we need to slow down and pump on the brakes, and the longer term dividend using AI is going to be much more impressive. And we just have to be patient with this technology. So in 10 years, we'll be looking back and say, wow, that was really great that deep learning was able to interpret medical images, automatically. But we'll also realize that that was, a relatively small dividend compared to what we'll be gaining in 10 years. So we have to be very patient.
And careful too, because medicine is different than technology.
Yes, and careful, right.
Devices is dealing with lives.
Well, we're already dealing with important issues like what do we do with potential bias that's in the algorithms? If a certain machine intelligence is dictating a certain strategy for patient care, was that algorithm really based on a heterogeneous group of patients?
Right.
Or is it biased culturally or racially? So I think we need to be very careful. And then another big area of concern is regulatory. Now that we have this amazing technology, how do we regulate it? Should we, regulate it like any other technology? And my feeling is artificial intelligence is not similar to other technologies like a device. So once you make a device, it's kind of fixed, at least until the next version.
Right.
Whereas artificial intelligence is much more much faster in terms of the evolution of that technology, so it can change in a matter of minutes. So how do we regulate a technology that has a moving target? It's going to be very interesting. I'm really grappling with that issue along with the state boards who I just met with last week, and then other big organizations like the AMA.
Are you getting a lot of resistance from them?
Not at all, actually. They're just, I
Okay.
think, they're just interested how we would devise a strategy that would find a sweet spot between some sort of oversight, at the same time not over-regulating so that we sort of hinder innovation.
Right.
So I really respect, all of the state boards and the AMA for having that really open-minded attitude, but at the same time, really being responsible for this new technology in medicine as well.
So I have so many questions.
Okay.
You're speaking, they're just flooding into my head. So
Sure.
the one thing I want to ask you is, how hopeful are people who are suffering with like Parkinson's and Alzheimer's and cancer patients? How hopeful can those people be that with all this cutting-edge innovation, there's hope that there may be successful treatments, if
Yes.
not cures?
Yes. I think in our lifetime, we're going to see some very impressive gains.
Wow.
Because, medicine has been evidence-based medicine and maybe a few breakthroughs, but relatively, dormant until the last 5 to 10 years when we started with CRISPR and genomic medicine, and now with artificial intelligence, we're starting to really feel like we're on the ascent part of that exponential curve.
Right.
So we have to be patient, though. We can't, again, be overexcited and expect all the diseases to be cured. We have to be really patient with the research, really patient with our resources available to slowly, solve the mysteries of medicine with advanced technologies. And I think one by one, the diseases will have a solution.
Oh, that
but
would
we
be
can't
so great.
over-expect.
Right.
Some diseases will take longer. Some diseases will still take, I think, a couple of decades to solve. But I think in our lifetime, we'll see a good number of diseases have genomic solutions, and also how we diagnose and treat will be in a totally different realm. I think artificial intelligence is sort of a major resource that's going to generate that, because it's
That's
probably the
awesome.
most exciting development
Of course.
in our generation of
Yes.
healthcare and medicine.
Yes, think of all the lives
yeah.
that were lost, some very
Yeah.
young, because
Yeah.
there was no treatment.
Well, it's going to be, we talk about antibiotics as the great,
Yeah, cure all.
advance.
Yeah.
So I think this is going to be much bigger and better than antibiotics.
That is so, I'm just so enamored and fascinated
Yeah.
with what you guys are doing, because recently I saw that they grew a heart from stem cell,
Okay.
a human beating heart.
Okay, Jennylyn, you're really
I know, I got
reading
you all
so
over the
much. Okay.
place. Yes. Can you speak to that? If
Sure.
you can't, we'll
yeah,
skip.
I'm a cardiologist.
But I know
so
you know everything, and you're a heart doctor. There you go.
I don't know
You can't
everything,
expect
but
me not to ask
I
a heart
do,
question, Mr.
love to keep
Cardiologist.
up with what's going on with the heart. But
Yeah.
I think it's very exciting. We've been waiting for tissue engineering for a long time in cardiology, because if you think about the advances in surgery,
Yes.
and I'm a pediatric cardiologist, so particularly in pediatric cardiology, it's just been amazing the last few decades, advances that have been made so that congenital heart defects, for instance, that used to see 100% mortality with any attempted surgery, now about 95+% of some of the children with some of the diagnoses will go home. So it's been amazing, but one big downside is when we need to replace tissue parts like a valve or other parts of the heart, it's been mechanical or biological that's fixed. So wouldn't it be wonderful in our lifetime if you need your aortic valve replaced, rather than having a mechanical valve or a bioprosthesis,
Yeah.
that we take some of your cells and have a scaffold, and your cells will see the scaffold and will grow with your own cells,
Wow.
regenerate essentially your valve, and then we use
Awesome.
that valve that's formed from your own cells and replace your diseased aortic valve with sort of a regenerated new valve. And we'll see that in our lifetime. I think the last decade or two.
Genius.
Yes. For the last decade or two has been a little bit frustrating. I think I think we overexpected that a couple of decades ago. We thought it was going to happen soon, and I think again we have to be very patient because I think it's going to happen. We just have to be very patient, and kudos to all the researchers in this area that really are working so hard on the whole process of 3D printing tissue parts. And
3D printing tissue parts.
Yeah.
You mentioned 3D printing before, and I
Yes.
had someone on my show talking about that.
Okay, so that's another
area. And he was
area.
wearing shoes that he made on his printer.
Yes, so that's another area that's exciting in medicine. So imagine that
Amazing.
we had, pre-made, prefabricated parts when we need parts replaced, especially in
What
orthopedic
kind of
surgery.
parts?
Well, in orthopedic surgery.
Oh, for orthopedics,
and
yeah.
plastic surgery.
Yeah.
And now we can actually individualize the part replacement with 3D printing. We can, and this is where artificial
Awesome,
intelligence.
people.
Yeah. Well, this is where artificial intelligence is actually pretty big, is trying to write a program that will pre-design a body part that
Yeah.
needs to be replaced. That's individual for that patient, So, and I think in the future also, this is sort of fantasy right now, but it's probably going to happen also in our lifetime. We're going to be using your cells to 3D print a body part. So they've already used 3D printing or 3D regeneration of cells to make, muscular tissue, to make blood vessels, bladder. So I think, more
And it's for
sophisticated
any
parts.
age group or just for kids?
For kids and adults, and I think mainly more in adults than children. And obviously, I have a special place in my heart for making sure this technology to be in children, because this is actually particularly good in children, because as you know, children grow up, they have different sizes. We can't have one size that fits all, literally.
Right.
So it's going to be particularly valuable for children. So all of these advanced technologies, they're not just exponentially improving, but they're exponentially converging also. So you can't do 3D printing without having some data science and artificial intelligence to help guide it. Just like you can't do genomic and precision medicine with all that data that's available now without some way of harnessing that data, which you need artificial intelligence for. So I know I'm an artificial intelligence enthusiast. I might be biased, but in fact, it is sort of the intertwining resource that we need to propel us forward using some, if not most, of the advanced technologies.
Whenever I have someone like you on the set, the time flies by like that.
Is it over already?
It's almost over.
Okay.
But we can't let this show end unless I ask you, what are some of the negative aspects of all of this? What have you encountered? Because there's no way it's all wonderful. It
Yes.
has to have some negative.
Yes, there are several negative aspects. One is human beings tend to, it's like we're holiday time, so some people love to just, unwrap the present right away and want to see what the present is. And I feel like we sometimes have that attitude about advanced technology, not patient enough with technology, and then get disappointed. So there's something called the Gartner hype cycle you may be familiar with.
Yes.
We overexpect, and then there's a big downturn, and then we kind of plateau, sort of like human relationships too. So I think that's true for technologies, that with certain technologies now, there's this sort of glorified look at all the technologies, and then we're going to be disappointed, a few years from now. But I hope that the disappointment won't be long, and also that we'll have the patience to ride through the technologies as they fail to meet expectation. And then 10 years from now, we'll be looking back and say, wow, that was an incredible decade of medicine, that we have all these things available now. And then we can go forward for another amazing, I think, 10 or 20 years. So this is the sort of the golden era of healthcare and medicine. And you feel the energy. Unfortunately, some of this excitement is being neutralized by something that's very pervasive among clinicians, which is burnout. 'Cause
Exactly.
doctors are overworked and overburdened. sometimes because of the technology, particularly in electronic records. But AI can help neutralize that, I think. I think AI can relieve some of the burden that is unnecessary, that's administrative, or that's just too mundane and repetitive for clinicians, and they ought to be focusing on the human aspects of medicine. So I think, as I was telling my friend Daniel Kraft, I think AI will rehumanize medicine if we use AI appropriately.
Right. And if you take your time and don't let people rush you.
Yeah, yeah.
So we're down to 2 minutes. Can you believe it?
No, it feels like it was just 5 minutes. Okay.
What haven't I asked you that you want to make sure you leave with the viewers?
I think we should all embrace new technologies that will really push us into the next century in healthcare and medicine. Hug your doctor, because that doctor is probably overworked. So it's ironic that when we talk about advanced technologies on the one hand,
Yeah.
but every time I talk about that, I feel like the human aspects need to balance that. So I think doctors need help in many ways, not just with technology, but from their patients too. So I think I'd love to see the doctor-patient relationship make a big comeback. And I think it's been a little bit of a challenge recently. So I think some of the technologies will help us with that.
Well, I am very grateful to you and all the other doctors like yourself who are working off the clock, because what you are doing is going to affect all of our lives and our children's lives for sure.
Yes.
And I think it was about time that we saw some treatments for some of these illnesses that we've seen taking people out, some of them very early in their lives. So,
and hopefully inspire the next generation of young people to go into medicine and not only think about the Silicon Valley giants to work for, and hopefully go into medicine.
Dr. Chang, thank you so much.
You're welcome.
I am
Happy
so much
holidays.
smarter because you're
Yes,
here. And thank you for watching Conversations with Jennylyn. And hopefully I can talk him into coming back sometime in the future to further update us on all the new developments. And thank you to my fascinating, wonderful crew. I cannot do these shows without them. And I'll see you next time.